Hello and welcome back. And when you see me here, it's Matters Health. And today I want us to look at a very important topic that mostly affects our women, and that is miscarriage. Now, if you're new here, please consider subscribing to our YouTube channel that is at Doctors on Wheels, at Doctor on Wheels, and also in our social media platforms that is our Premier Hospital and that's Ngong for Instagram and our Premier Hospital Ngong for our Facebook page. So, before we start today's topic, I want us to listen to some words of wisdom from the book of Acts, chapter 20, verse 35. And the Bible says, "In all this I have shown you that by working hard in this way, we must help the weak and remember the words of our Lord Jesus, how he himself said, 'It is more blessed to give than to receive.'" Thank you. So let's dive into today's topic. So today I want us to look at miscarriage, or in other words, what we call abortions. What is miscarriage? Miscarriage is loss of pregnancy before viability. So before that baby inside that womb is viable to survive outside. Okay. Now, miscarriage can be explained in different scenarios depending on where you come from or depending on the country of your origin. For example, someone who probably is in the Western countries, their miscarriage will say loss of pregnancy at 20 weeks of gestation, because at 20 weeks, okay, the baby can survive. They have enough, complicated machines that can support this baby to be able to survive all through. But under our scenario here in Africa, sometimes it might be difficult for us to help that baby to survive at 20 weeks. So then we decide to push it to where we are able to. So in some certain scenarios, we will say a loss of pregnancy before 28 weeks of gestation. So it depends on where you're coming from. So the mostly accepted one now will be there around 20 to 24 weeks of gestation, or if the baby is less than 500 grams or half a kg. Now, loss of pregnancy can either be spontaneous, what we call spontaneous miscarriage, or what we call induced miscarriage. Now, when you look at the spontaneous miscarriage, okay, those are those miscarriages that basically take place without a specific, of course, without the intervention of someone, okay, so it spontaneously happens, okay, and they can either be, we looked at in our other videos, the types of abortions or types of miscarriage. We say that we can have a threatened abortion or threatened miscarriage where the baby, okay, the placenta has started detaching, but it has not completely detached. So therefore, if you give quality care to this mother, it means that you can actually save that baby and the baby can continue to grow to term. And then the other type of miscarriage is what we call inevitable. So inevitable is basically where the placenta has already detached from the wall of the uterus, and therefore you cannot save that pregnancy. So either way, it has to come out. And then we have what we call incomplete miscarriage. This is where the pregnancy, part of the pregnancy has already come out. So either the baby has come out, so it's only the placenta remaining. So basically, some of the membranes might be remaining inside the womb. And then we have what we call complete, whereby all the products of conception or all the products of the pregnancy have come out, okay? And then we have septic miscarriage, and septic miscarriage is any of these that we have talked about, but that has been infected. So there is some infection, especially in the womb, okay, or the baby got infected, okay. So basically get a miscarriage, but then infection sets in, and then and there is another type of miscarriage, what we call missed So missed miscarriage is where the baby basically died in the womb long time ago, okay, but then you never knew. So for you, you're just there, you think that you're carrying a baby, but then the baby died long time ago. Then you basically, at some point, you tested positive for pregnancy, but then all the pregnancy symptoms have regressed. So the baby died and never came out, okay? And you realize that the pregnancy symptoms are not there. And then number two as well is that you do not have um, um, the baby, the tummy is not growing, okay? So no pregnancy signs, no signs of growth for the baby. It's called a missed miscarriage, okay? And then the second type, we said we have spontaneous, and then the other one is induced, okay? So the induced one can either be medically induced or it can be surgically induced, and it only induced when the mother the life of the mother is at risk. So medically induced when the mother is at risk, or when the baby is the type of the baby that is growing in the womb probably might not be very there is some major genetical issues with this baby, or that baby might not be able to survive when the baby is born. So basically you end up terminating that pregnancy. Now, what are some of the major causes that can cause loss of pregnancy, or what we call miscarriage? So number one, we have the maternal causes. So maternal causes are basically those causes that are emanating from the mother. So a mother who has chronic illness, okay, like diabetes, hypertension, thyroid disease, okay, they are uncontrolled, okay, so they are not well controlled. They are actually at an increased risk of losing that baby. Number two is infections, okay. Malaria has been one of the major causes of miscarriage, okay. Syphilis has been one of the major causes of miscarriage. Okay, toxoplasmosis, okay, people who have had such kind of infections, rubella, which is more of a viral infection, and then cytomegalovirus as well, which is one of those infections, they have been associated with miscarriage. But as well, infections such as urinary tract infections, we talked about UTI as a cause of miscarriage, and then direct trauma to the tummy. Okay, so you're either involved in a road traffic accident and there was an injury directly to the tummy, and therefore the placenta detached and the baby came out, or can easily come out. And then the other thing is anatomical abnormalities of the uterus. Like for example, if the uterus is full of fibroids, okay, so the baby is not able to grow well, okay. So once the baby continues to grow, it reaches a point, the uterus just decides to contract and gets rid of the baby. Or when you have a septate uterus, okay, so that uterus, we talked about pelvic inflammatory disease in our previous video, and we say that is one of the major cause of a septate uterus, okay. So that uterus which is not able to expand well, it has some pouches here and there, and therefore it cannot support the growth of that baby, and therefore the baby can easily be terminated. And then the other thing that has been one of the major cause of miscarriage is cervical incompetence, and I'm going to do a separate video just specifically for cervical incompetence. So when we talk about cervical incompetence, we're talking about a cervix that is not able to remain closed all through the process of the pregnancy. So it reaches a point where it just opens on itself, and once it opens, the baby comes out, okay. So most of the time this cervix is very small, okay, a very small cervix, which basically with just minimal pressure of the head of the baby, it just opens. So either very short cervix or a very weak cervix, okay. And then we have the fetal factors. So the fetal factors is mostly thus the congenital abnormalities of this baby. So if this baby has congenital abnormalities that are not compatible with life, okay, the body can actually just decide, let's get rid of this baby, because this baby will not be able to survive well when this baby is born, okay. But also chromosomal abnormalities, which account around 50 to 60% of the causes of miscarriage. And then we have other causes like placental causes like placental insufficiency, when basically the placenta is not well attached, but also which means then the baby is not able to receive enough oxygen, enough nutrients, therefore the baby is not able to grow well, and at some point you can easily get the baby out. Or the placenta has not implanted in the right places. We talked about placenta abruptio and placenta previa. So placenta previa is when you have the placenta just near the cervix. Okay, so with vigorous sexual exercise, you can easily disrupt the placenta and it can easily detach. Okay. And then we have other external factors such as exposure to radiation. We have talked about some drugs. I'm sure you will be told that there are some drugs that you're not supposed to use during pregnancy because of their effects when it comes to the baby. Okay, severe malnutrition. When the mother is severely malnourished, it can actually cause what? It can actually cause miscarriage. So those are some of the major causes of miscarriage that you need to be aware about. Now, when you come to the hospital, what are some of the things that will be done? So number one, we are going to confirm that you're pregnant, especially for the early pregnancies. And then number two, most important test that will be done is an ultrasound. So the ultrasound basically helps to look at the fetal heart rate, so the fetal heart, but also it looks at the placenta, whether the placenta is completely detached or it's still intact. Okay, and then we'll also do a test called full blood count. The full blood count helps us to know exactly the amount of blood you have lost. Okay, so it helps to determine the anemia. Okay, but also it helps to determine whether there is any signs of infection. And then there are some other tests that will be done like anti-D and anti-rhesus factor and blood grouping. And also you will be done a screening test. So basically we are going to screen for all those infections like the malaria, the syphilis, okay, and the toxoplasmosis, cytomegalo, and all those that can actually cause miscarriage. Okay, so once any type of those miscarriages have happened, so what are we supposed to do? Okay, so number one is the patient is supposed to be stabilized. So for those who have lost a lot of blood, they will be given some IV fluids, and if you have lost a lot of blood, you will need to be transfused. Okay, so that basically you are stabilized. Okay, and then number two, for inevitable abortion, incomplete abortion, you will need to be evacuated in the process, what we call the manual vacuum aspiration. So those remaining products, they will be removed. Okay, so that it helps to reduce the bleeding. And then number three, you will need antibiotics, because we talked about pelvic inflammatory disease, and we say that there is a mucus plug that helps it acts as a mechanical barrier for infection not to get in the uterus. So this time the cervix is open, so it's easier for infections to go up. Okay, and in the same process, if the person who is doing the evacuation, they have not observed a sterile procedure, it's easier for infections to set in. So antibiotics is very important. Okay, and then the other thing that you need is counseling. First of all, you as an individual to be counseled about the mother to be counseled about the loss of that pregnancy, but also the family needs to be counseled about the loss of that baby. Okay, and then of course we've talked about screening. You need to be screened for the other causes like sexually transmitted diseases. Now, what are some of the complications that you are expected if you are not well managed? So loss of a lot of blood. Okay, you can lose a lot of blood, and in that process you can easily go into hypovolemic shocks. That's why stabilization is very important. And then sepsis. Okay, infection can set in. That's why antibiotics is very important. Okay, and then in the process of evacuation, sometimes with that kit. Okay, you can easily, if you are not very careful, especially for the healthcare worker, you can easily pop the uterus and get a perforation, okay, or even cervical injuries. And then what are some of the late complications of persistent miscarriages? We talked about the Asherman syndrome or the uterine adhesions. Okay, you can refer to our video on pelvic inflammatory disease. And then the other thing is infertility and chronic pelvic pain, and as well as psychological effects because of the loss of that pregnancy. That's why counseling is very, very important. Now, if you have found this video very useful, please consider subscribing to our YouTube channel. Just go to @Doctor on Wheels. Okay, subscribe and turn the notification bell so that we are able to know you are able to be notified every time we upload a new video. You can also visit us at our hospital, that is our Premier Hospital. We are located at Lupsil Center, that is in Gong, opposite Juango Petrol Station. And if you experience any of these, we will be able to help you. Until next time, God bless.